Hello, and welcome again to Courageous Doctors, the new show for you and your doctor. On today's show, we will cover Obamacare updates, other healthcare news, and health and safety tips. Now let's begin. The House passes the American Health Care Act. So what does this mean? First, we need to see how it's going to look once it gets past the Senate. It may look completely different. To me, my take on this is it's just what we had before Obamacare with a few changes, but we'll see what the Senate does to it. Let's look at it a little different. For example, insurance companies will now compete with each other by selling smaller packages instead of having Obamacare standard regulated care. So how does this get cheaper? Well, for example, it might leave out maternity care, it might leave out mental illness care, and it might even leave out hospitalization. Also, you're going to pay more for chronic illness and pre-existing conditions. Now, supposedly, states will have money for high-risk pools for chronic illness, and that's no different than what we had before Obamacare. And the bill says that they're going to allow for tax credits, so as you get older or you have more chronic illness, maybe you'll be able to afford more, but most of the pundits that I've been reading don't really think that the tax credits are really going to do much to pay for these increased prices. So we're probably going to rely on state pools like we did before for these high-risk pools. Now also, we're probably going to see lifetime limits. So if you have an illness on Obamacare, you could keep paying for your illness forever. Now the insurance packages you're offered, including on your employer's health insurance, you might have limits as to how much they'll pay for a certain illness. States are going to go back to block grants for Medicaid, where the state will pay for half of it instead of right now 90% is paid by federal. And the only thing I can say about that is Jersey, who was one of the lowest and poorest performing in Medicaid and Medicaid payments to clinicians. Very few doctors signed up with Medicaid. I, as a general pediatrician, had a lot of trouble finding people to see my patients. They ended up in the emergency room because nobody else would treat them. You couldn't get rehab or speech or whatever else they needed. So good luck on that. I think we're going backwards on Medicaid, but we'll see what happens. Now, there are some good things. You're not going to be penalized anymore if you don't have insurance. You won't have that tax penalty, and that was a pain. Hopefully, companies will now compete across state lines, and that may give us cheaper premiums. But hospitals are saying they're being hit the hardest. Remember, before Obamacare, hospitals used to get something called charity care, where they would get reimbursed for taking care of poor patients or people who were uninsured. In other words, people that didn't have Medicaid or Medicare or something else. The governor has been decreasing the amount of money into charity care, assuming that everyone had been on Obamacare. But, for example, we've gone from $500 million to $300. Now he's cutting it another $50 down to $250. So hospitals are saying, I'm going to be losing money, and who knows what they'll do. All right, let's move on. So we'll follow the new health care bill on this program, and we'll try to editorialize it and keep you up to date, and let's see how it looks when it comes out of the Senate. Star Ledger reports that regarding paid family leave, this is very interesting, that people who really need paid family leave aren't using it. What is paid family leave? It says for 6 weeks, supposedly, you'll get a 1/3 cut in pay, but still be paid, even though you're out taking care of a sick member. Hopefully your job will be there when you get back. Apparently your job's not always there, and apparently the people that really need it can't afford that. For example, if you made, let's say, $15 an hour or $600 a week, a 40-hour week, you'd be taking home $400 instead of $600, after whatever is the after taxes on both those, and people can't afford that, so they don't simply take off the paid family leave. So we have to do something to really fix that. Now, there is something that I am very much in favor of, and people will take advantage of it, and they should, and that's paid sick leave. Unfortunately, the governor would not allow it through the state. But there are individual cities in New Jersey that have it, and that's very important because if you're sick, you really need to take off to take care of yourself, whether you're a food handler and you don't want to contaminate us and poison us in the restaurant, or whether you have to take care of your grandma or a sick kid or something. You should have the right to go to the doctor and get paid for that day. So paid sick leave, not paid family leave, they're both good, but paid sick leave, we definitely need to work on passing statewide. Well, this is a good thing. The Ledger says that JFK Hospital is out of trouble. It's merging with Hackensack, so hopefully it'll be solvent. CNN says that the new FDA director, Dr. Scott Gottlieb, who has a lot of experience in the pharmaceutical company and as well as in bureaucracy and executive management, and he thinks that he can make changes, decrease regulations to help the Federal Drug Administration that's in charge of licensing drugs to get the drugs out faster, especially the cheaper generic drugs. Dr. Gottlieb said that one of the problems was there's so many regs that the FDA officials just can't get the drugs out fast enough. So they're going to loosen that up a little bit and hopefully not hurt us with drugs that are not well looked at. But I think that he's probably got a point there. He also says by taking away some of the taxes and the burdens on the pharmaceutical companies, they will be freer to once again do more of their research, and we really need that. And he's also bringing in and allowing investment companies like the hedge funds and people like that to take a bet on backing some research in pharmaceutical companies with the idea that if it doesn't go through or bombs out or fails, the pharmaceutical company doesn't have to take a hit to whoever stock is investing in that investment company. I guess it comes back to you and I, we take the hit. But Congress has voted to remove payment for Planned Parenthood. And so we're going to have to see, they had given about $25 million a year. And we're just going to have to see if these women can find alternative care. We'll keep you up to date on that. This is interesting. The Washington Post reports that the Department of Agriculture is having trouble inspecting dairy farms, milk farms. And apparently, I didn't know this, the farms can hire their own inspectors, so the agricultural inspectors don't even have to go in. But they want to see how much time the cows spend actually grazing outside and whether they're eating grass rather than being fed something like corn or soy. For all of you that are more concerned that you have a cow eating grass rather than corn or soy. So what they do is they measure in the milk levels of conjugated alpha-linoleic acid or omega-3 alpha-linoleic acid, and apparently those are only high if the cows are eating grass, and those levels were low, so they know that these people apparently were not truthful and these cows were not actually eating grass. So something to follow up. Be sure that, if that's a big concern to you, just be sure the milk you're getting is really from grass-fed cows. And the Washington Post also said the Secretary of Agriculture has taken away the strict regulations that Michelle Obama had put on schools to lower sodium and sugar, and they said that they would, the children like foods that have more sugar and salt and taste better, and so they might eat them if they're not as healthy. So that's where we're going now. All right, let's move on to other healthcare news. USA Today is discussing about the nationwide outbreak in mumps. Now, we've always had outbreaks every year in mumps, usually on college campuses, but apparently it's a little more widespread now. It's just a matter of making sure we all have had our vaccinations for mumps. Likewise, there's an outbreak in Minnesota, but with measles. Apparently, it's, if you remember the outbreak we had last year was, we get them every year, but this one is specific for the African Somali community that I guess doesn't believe in measles vaccines. So, if you have people that are traveling to the Minnesota near this community, just be sure they're vaccinated against measles, which they probably are anyway. Most of the country is anyway. The FDA has recalled the soy nut butter contaminated with E. coli from Dixie Dew products. We reported on this last news show. This is an ongoing thing. Just be sure that the products you're buying from this company are the new ones and not the recalled ones. The Ledger said that we have a resistant candida. That's a type of fungus. It's resistant to most medicine. It's in Jersey. It's not a lot, but somewhat. Candida are the yeast infections. You're all familiar with it. Women are prone to it. People on antibiotics. That's why you always take probiotics with antibiotics. People are immunosuppressed. People who are using oral steroids and don't rinse their mouth. Inhaled steroids like with asthma and don't rinse properly. It's yeast, it's thrush, it's a type of fungus, so it's going to be harder to treat if you happen to get that one. Associated Press is saying that we're having an increase in Campylobacter. You know Campylobacter, that's one of the dysenteries. It's always if you swapped every chicken in the supermarket, most of them would probably have Campylobacter, just like raw milk. But they're just reminding you the infections are increasing, so cook your chicken well, and I guess don't drink milk right out of the cow, I guess. The Ledger is warning of the disease HPS, hantavirus pulmonary syndrome, which is a deadly disease. It comes from mouse droppings. It's usually out in the Midwest, like I think Rocky Mountain area and all, but apparently it's locally too. And so just be careful when you're cleaning up after mouse droppings. You don't want to, die from this disease. CNN reported on tape the pork tapeworm, but this is interesting. It's not from eating pork. These infections were from eating undercooked snails. So the pork tapeworm was an undercooked snail. So for all you lovers of, escargot and all that stuff, just be sure it's actually cooked. Washington Post is warning us that the yellow fever vaccine is undersupplied. I think we've reported this before. Sanofi company had trouble with manufacturing. We're trying to get another vaccine in from France. But I know I've had this problem with some of my patients going to Africa. They needed yellow fever vaccine, and it was a problem because it's hard to find. So you really give yourself, if you're going to Africa and you need to get the yellow fever vaccine, please give yourself extra time because you may have trouble finding it and they won't let you into the country. Also, it was recently reported this past week that Ebola has once again broken out. Hopefully it's a small controlled area, but just be careful that Ebola's not in some area where you're going. Fox News, this is interesting, reported on Florida. Remember the big Zika outbreak in Florida and all the problem with mosquitoes and South Beach and all that stuff around Miami? Well, they're now releasing mosquitoes that are treated with a certain kind of bacteria that sterilizes the mosquitoes with the hope that you'll have less mosquitoes to carry Zika. So good luck, Florida. I hope it works. The Ledger reports that the HPV, that warty virus that all the teenagers are getting vaccines against so they won't get cervical cancer, the papilloma virus causes genital warts. And they said that they've done studies that show 40% of us as adults actually have this virus, and this virus puts us at risk for cancers in the women, more cervical cancer, and the men, anal and mouth and throat cancer. So, take that for what it's worth, but hopefully we'll try to prevent it in teenagers before they get it like us. Washington Post, is interesting. The federal panel has reversed its decision against PSA, the prostate-specific antigen test for people like myself, older men that are, worried about getting prostate cancer, and we want to test our blood for that every year. Although the urologists, and I was part of the medical society fighting this decision years ago, saying it's ridiculous. You know, you want to know if you're going to have cancer to treat it before it happens. It's like telling a woman don't get a pap smear or a mammogram. I mean, how stupid can that be? But some people in bureaucracy come up with these stupid ideas. They call it research, like a lot of things they call, but we won't get into that. But anyway, they have gotten smart on this issue, and we now, again, can get our PSA testing and have it paid for. Washington Post, this is interesting, said there's a new class of drugs coming out. We apparently haven't had new classes of drugs. We've just been trying to improve the classes we have. There's a new class coming out to boost our immunity. We're looking forward to that. This is interesting. CNN said that frog mucus, apparently frog mucus has a lot of ability to fight the flu and other germs, and they're trying to package it in some kind of form that we can use. I think the company's out of India. Interesting history. I don't think it's out yet, but the research looks promising. They said if you go back to ancient Russia, they used to put frogs in their milk to preserve the milk and make it fresh. So I guess the ancient Russians knew this, and apparently the Indians did too. So this will be a nice new drug. We're always looking for new drugs. Here's an interesting study. Somebody looked back at all of the women who were pregnant in early pregnancy and had taken medicines to see which ones had actually gotten harmed or not with their fetus. And they found that penicillin actually didn't really cause the problem. So we see this all the time. I see young mommies in my office that are pregnant, and the big fear is, will their obstetrician give them medicine for a strep throat or something? And again, you have to ask your obstetrician. Always ask your doctor first, but it is good news that maybe the penicillins would not harm the fetus, and that's excellent news. This last piece of information on this part of the news is from the Ledger. For all you men that were looking for vasectomies, or probably not you, probably your women were telling you to, they're coming out with a new drug in the future. It's a gel that can be injected right into the testes, and it will do something to clog up the sperm or change its polarity from negative to positive or whatever, or positive to negative, so that it can't move or do its job. Apparently it's reversible by getting rid of the gel, injecting something else, but it's maybe an alternative to vasectomies in the future.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Now let's move on to health and safety tips. The mold outbreak in the University of Pittsburgh Hospital, where some patients got very sick, came from moldy linens. So hopefully they changed their linen service. The Wall Street Journal reminds us about the EpiPen recalls. We're seeing a lot of this. I'm getting letters from many of the insurance companies to call my patients and tell them to go down and get new EpiPens. We've called as many as we can. But if you have EpiPens, it's easy. Just ask your pharmacist if it's one of the ones being recalled, you can exchange it. CNN says that and this is kind of scary, be careful with preparing fruits and vegetables if they were harvested too early. I didn't know any of this, or if they're not prepared well, they can actually be poisonous. You can poison yourself with fruits and vegetables. Go figure that one. They gave examples like lychee fruit, cassava, and raw red kidney beans. So I guess just wash and cook and prepare everything and hope for the best. The Associated Press, and this is something we've reported before, is reporting on the FDA's warning of using codeine or tramadol in children. I think we've reported on that before, but they're reminding us again. Fox News, and this piece of news is pretty scary. Fox News says that 1 out of 12 people now are having trouble affording their water bill. This just blows my mind. It's just really hard to comprehend. And that in 5 years, I think, in 5 years, 1 out of 3 people will have trouble affording water. I mean, water in your home, this is in a third world country. The last time I checked, it was America. We got to get this right, people. There's something going on. I mean, how can you not afford your water bill? Scary stuff from Fox News. New York Times. This is a fun thing. The New York Times reports from the American College of Sports Medicine that let kids get up and move around, and that may be their only exercise during the day. Let's go back to old-fashioned. I wonder if all the old-fashioned teachers we grew up with, who used to let us get up and walk around just so, we could let off some energy and things. I wonder if they really knew they were exercising us. Fox News. These last 2 points are really interesting. Be careful that your healthy food, quote-unquote snacks, don't have extra sugar or syrup. And they went into detail. Yogurt, granola, fresh pressed juices, packaged fruits and vegetables, low-fat salad dressing. They said just be careful that there's no extra sugar or syrup so that it really is low-fat, low-sugar. And they even said pizza can actually be a good snack if you're careful the way it's prepared. But hold the sausage, hold the pepperoni, and hold the extra cheese. Now, The Atlantic lastly reports that reading your egg carton for its labels can be very misleading, and I had no idea about this. I faithfully do all the right things in buying eggs, and I had no idea that it may mean nothing. But, for example, cage-free, right? Cage-free, let's have chickens that run around. Cage-free may still mean that the chickens are packed together but not in a cage. Go figure. Free range. Oh, yeah, that was like Grandma's Chicken Farm, right? I thought for sure that's a good egg. No, free range may mean 2 squared feet to walk around. Hormone-free, apparently that's a good thing. Antibiotic-free is good, and no pesticides is good. So just be careful reading the labels. And that brings us to the conclusion of our new show. We look forward to seeing you again next week. If you're seeing this before Mother's Day, have an enjoyable Mother's Day. And as always, let us know your feedback. We welcome it. And enjoy the rest of the day, and we'll see you again next month.